Hi there, this is Jonathan Ginsberg, and today I'd like to talk to you about a medical condition called failed back syndrome. And I've had several failed back syndrome cases over the last few weeks actually, and it just occurred to me that this would be something that would be interesting to talk about because, again, it's becoming more prevalent for a number of reasons, and I wanted you to know how I approach these cases. So first, let me just confirm the definition if you're not sure exactly what I'm talking about. Essentially, a failed back syndrome is a situation where you may have undergone back surgery. It could be a fusion, it could be a microdiscectomy, and the surgery initially resulted in a reduction in your pain, maybe an increase in your mobility. But after 6, 8, 10 months, you start to notice that scar tissue is forming, arthritis is coming in, and that your pain level is gradually beginning to increase again, to the point where within a year, again 9 months to a year, your level of pain is maybe a little different than it was prior to surgery, but it's no less debilitating and bothersome. And you go to the doctor, and no matter what they do in terms of physical therapy or adjustments of the hardware, if they can do that, it doesn't really seem to help. And so a lot of times people with failed back syndrome find themselves on long-term pain management, and again, they're not a whole lot better off than they were before. And again, the pain can be different, but it may be no less debilitating. And a lot of times the reason why failed back syndrome happens is that my clients simply don't have the money for appropriate follow-up. Normally when you have back surgery, the ideal situation would be to undergo physical therapy where you re-strengthen your muscles, you develop different muscles, different core muscles, for example, and it really helps you learn to lift things differently, move differently to maintain your flexibility. But if you don't have the money for that and you don't have a good at-home program or you're not able to keep up with it, then arthritis will set in, and once a year goes by, it's very difficult to get that mobility back. A lot of times second surgeries are not an option. Surgeons are reluctant to perform a second surgery on someone who did not have a good result the first time, and sometimes realize that some people just naturally form scar tissue, or they naturally get arthritis or osteophytes in their spine. And so your doctor may be reluctant to operate on you again. You may not have insurance anymore. So for whatever reason, I see people a year, 2 years after their initial surgery, and they come back and they're just really not in a position to work, to do much of anything. They're in excruciating pain, they have very limited movement, and they're basically on long-term pain management. And the complications that I see typically would be what you would call decompensation from work, and that basically means that you've lost your muscle tone in the core muscles that help support your back. You could be depressed from being in a chronic pain management situation. That's very common. You could find yourself dependent on narcotic pain medication. And that also can lead to some complications where you're not able to function reliably in a work setting because you've got all these pain medications you're taking. And the pain medications themselves have side effects such as constipation. They can engage in mood swings and so forth. And again, depression can arise from just being in that situation. So usually if it's been a year or two after surgery, it's not been successful, and you're experiencing some of these complications, it's very, very hard to snap back from that. Even if you do get another surgery, it doesn't necessarily mean you're going to be better. And a lot of times what you'll find is the doctor will kind of throw his hands up and say, this is a failed back syndrome case, and try to put somebody on long-term pain management. A lot of times they end up with me applying for Social Security disability, which ideally is not where you want to be, but it's better than nothing. Now, obviously, Social Security is not going to resolve all of your problems, but it does do a few things for you. Specifically, it can give you some access to income so you can live with a little bit of dignity. It can give you access to Medicare after a certain amount of time has passed, 25 months, I believe, from the date of your first payment. And I think most importantly, in a lot of ways, Social Security disability will validate what you've been through. If you've gone through a surgery, it didn't work really well, you're not able to work, your lifestyle probably has changed. If you're married, your spouse may be getting very frustrated, your relatives may not understand what's going on, and getting on Social Security disability in a lot of ways validates that. You've had a third party, an objective third party, look at your situation critically and decide that yes, you meet the requirements for Social Security disability. So in that sense, that validation can be very, very helpful. I think the keys to success, if you've got a failed back situation, would be these are things that you really need to do to make your case work better. One is you need to be compliant with your medical treatment, and that means that even if it doesn't seem like your doctor is helping you, continue to go to the doctor, do what the doctor says, try the different medications, try different physical therapy, whatever you can do. Show that you're making a real effort to try to get back to work and to get better. So that's one really important factor that judges are going to look at. A second thing is you want to have a really positive attitude as much as possible. And what I mean by that is when you go to the doctor, don't go in with the idea, I know I'm disabled the rest of my life and I'm terrible and I need more pain medication. Go in with the idea and tell your doctor, you'd like to do what you can to get better, and try to ask for encouragement and show that you're not looking for pain medication handouts. You really want to show the right attitude, because that sort of thing ends up in your medical record, and you want the doctor to describe you as a person who is motivated to get better and is not looking for narcotic pain medications and is really trying to improve your lot in life. And the third thing is a pain diary. I think a pain diary can be very helpful in showing what you've gone through. It's difficult to remember what you were feeling like 6 months ago or 8 months ago, but if you keep a pain diary, that can really help you jog your memory when you get to a hearing. So you want to really make note of what you're going through. If you need some help, have a spouse or a relative or a friend help you with that. But that's very, very helpful, because it shows that you're really looking at this over a long term, and it'll help you remember when you get to a hearing. So those are some tips about what to do about failed back syndrome. I hope you don't have it. If you do, please give my office a call. We're happy to help you. My office number is 770-393-4985. And if you like this video and some of the other videos on my channel here, please share them on Google+, on YouTube, Facebook, whatever social media you use. It's very helpful to me to get the word out. So for now, this is Jonathan Ginsberg, and until next time, I'll talk to you soon.